Hello YouTube, I'm Dr. Fox. Today, I'm talking about scheduling your baby's bath. Scheduling your baby's bath means that instead of waiting for labor to start naturally, you and your midwife or doctor decide when your baby will be born. So why would you schedule your baby's bath? Sometimes there are health reasons for doing this. However, we do not recommend you schedule baths for non-medical reasons, just because you want to have a baby a little early. As long as you are both healthy, it's best for the baby to be inside you until at least 39 weeks. Okay, if you schedule your baby's birth, what happens? Either labor is induced, called induction, or you have a C-section. Doctors induce labor either by giving you medicine or you breaking your waters so your baby starts getting ready for a vaginal birth. This causes the muscles of your uterus to start contracting to help push your baby out. If you are having a C-section, you will be prepped for surgery as your baby is born through a cut in your belly and uterus. Okay, question. Can you choose whether to schedule your baby's birth? In some cases, you may not have a choice. For example, if your doctor spots that something is going wrong in the womb and need to get the baby out early, or if pregnancy is causing severe problems to your own health, such as preeclampsia or gestational hypertension. But if your provider advises you to schedule an early birth, you can always ask if it is possible to wait until 39 weeks. Okay. Why does your baby need to be inside you for 39 weeks? If she's born too early, she may have health problems both at birth and later in life, including difficulties with vision, hearing, and breathing. Your baby is still developing her lungs, liver, and other organs inside you until 39 weeks. The brain, in particular, develops starting the final weeks of pregnancy. In fact, at 35 weeks, a baby's brain always weighs 2/3 of what it weighs at 39 to 40 weeks. As well as that, she will put on more weight in the womb and will be able to suck and swallow and stay awake long enough to eat when she's born, which pretty much all babies struggle with. So next question, will scheduling an early birth harm your baby? If there isn't a sound medical reason for this, my answer is yes. But remember that sometimes you don't know exactly when you got pregnant, and even an ultrasound can't always tell how many weeks old a baby inside you is. So if you try and guess a good date to schedule a birth, your calculations may be as much as 2 weeks wrong, and an extra 2 weeks in the womb has a big impact on the developing baby. Okay, when you get to 39 weeks, can you ask doctors to start the birth then? Hospitals have different policies about whether or not birth can be induced if there is no medical reason to do so. So, you need to ask early in your pregnancy when you are putting together your birth plan. Although the cesarean section can be the best option if your or your baby's health is threatened, it does have its own risks. So healthcare staff always prefer to let labor take its natural course if possible. If you have a C-section, your baby may have more breathing and other medical problems, and you are more likely to need another C-section if you have another baby in the future. It also means it will take longer to recover from the birth, as a C-section involves major surgery, so you will have to spend 2 to 7 days in the hospital and then a couple of months recovering at home. And as with any surgery, there's a risk of complications such as infections or bleeding, so you will have to stay in close touch with your healthcare providers even after you and your baby are back at home. Okay, thank you for watching. See you soon.